In a world where attention spans are shorter than ever and distractions are constant, focus feels like a luxury. Welcome to the reality many of us face today. With ADHD diagnosis skyrocketing, some are asking, is ADHD becoming the new normal? In the UK, between 2000 and 2018, ADHD diagnosis surged with a staggering 20-fold increase in diagnosis and a 50-fold increase in prescriptions for men aged between 18 to 29. In the United States, ADHD continues to be one of the most common neurodevelopmental disorders. Recent data reveals that about 11% of children aged 4 to 17 have been diagnosed with ADHD. For adults, an estimated 8.7 million, 4.4% of the population live with this condition. Between 2 to 5% of school children and about 3 to 4% of adults have ADHD in the UK. So what's driving the trend? Increased awareness. Most people, including celebrities, influencers, are openly discussing ADHD and they're recognising the symptoms. This helps to reduce stigma and encourages individuals to seek help. We have an improved diagnostic criteria, so our understanding of ADHD has evolved significantly. We have more accurate diagnosis. We have reduced stigma now. As awareness grows, more people are much more comfortable talking about their experiences and seeking assistance without fear or judgment. And we have also some societal changes. So with a world filled with constant distraction from smartphone to social media, it could make ADHD symptoms worse, making it harder for people to focus and stay organised. Platforms like TikTok have played a pivotal role in raising ADHD awareness, particularly among young adults, creating communities where individuals can share their experiences and strategies. Studies show that ADHD diagnoses are about 2 times higher in the most deprived areas, highlighting how social and economic conditions can impact the mental health of people in those areas. It's essential to recognise that ADHD is a real neurological condition. Imaging studies have shown structural differences in the brains of those with ADHD compared to those without. However, the increase in diagnosis doesn't necessarily mean ADHD is becoming the new norm. What we're witnessing is likely a combination of better recognition and diagnosis alongside societal factors that may be pushing more individuals towards the ADHD spectrum. This surge in diagnosis and prescriptions has put significant strain on the healthcare systems. In the UK, ADHD services are reportedly swamped with long waiting lists and limited access to diagnostic services. This situation poses challenges for individuals seeking help, as well as for healthcare providers and the economy at large. The impact of untreated ADHD can be substantial. Adults with undiagnosed ADHD may struggle with concentration, memory issues, disorganisation, poor time management, impulsive behaviour, lower self-esteem, depression, possibly difficulties in relationships and at work. However, it's really important to recognise that many individuals with ADHD possess unique strengths, such as creativity, quick thinking, the ability to hyper-focus on tasks that they find engaging. So is ADHD the new norm? Not exactly. ADHD still affects a minority of the population. In the UK, between 3 to 4% of adults ADHD. Many remain misdiagnosed. The key takeaway is this: ADHD isn't normal, but it's more common than one once believed. In our fast-paced, high-stimulated world, it's normal, expected that people will be experiencing ADHD symptoms. But if you're concerned about your focus and attention, don't hesitate to speak to a healthcare professional. Remember, seeking help is a sign of strength, not weakness. With proper support and management, individuals with ADHD can live very fulfilling, happy, successful lives. So let's continue to learn more about ADHD and its impact on individuals and society. It's crucial that we work together towards improving access towards diagnostic services, treatment options, and support systems for those who are affected by this condition.